Ibn Sina was born in September 960 in the village of Afshan, near Bukhara. His father Abdullah and mother Satara liked the name Hussein very much, so they decided to name their first son Hussein. Little Hussein was a very curious child. He spent the whole day asking the question why. This amazed both the older and the younger ones. No one doubted that the child would have a great scientific future. When the boy was 5 years old, he was sent to primary school. He studied there for 10 years. Hussein was the youngest of 15 children in the class taught by a teacher named Ubaid. The school taught the surahs of the Quran. Most of the children knew Arabic very poorly. Hussein never tired of asking the teacher too many questions. The teacher always told him, "Read the Quran. There is an answer to every question." Hussein also went to another teacher at the same time and learned grammar, stylistics, and Arabic from him. One day, Hussein came to his teacher and said that he had understood the Quran. Then he asked, "Can I ask my questions now?" The teacher seemed offended by Hussein. They read the Quran for many years, but very few people know the Quran by heart. A person who knows the Quran by heart is called a Hafiz, the teacher concluded. "So, I am a Hafiz," the boy said. During the exam, Hussein recited all the surahs by heart. It turned out that even his teacher Ubaid himself did not know the Quran at this level. In 990, the future great scholar, at the age of 10, amazed everyone with his ability to recite the Quran by heart and his deep understanding of Arabic literature. His father, confident in his son's ability to deeply understand everything, decided that his son should take lessons from teachers who were experienced in various fields of science. Hussein studied mathematics, physics, logic, jurisprudence, astronomy, philosophy, geography, and other sciences with great effort. He even surpassed his teacher, Abu al-Nadig, who taught philosophy and mathematics in many matters. After giving a deep analysis of a number of issues, his teacher was completely confused. The teacher advised the boy's father to create conditions for Hussein to engage only in science. It seemed that the teacher's knowledge for teaching Hussein was exhausted. Hussein had learned 5 or 6 theorems from Euclid's principles with the help of his teacher, and the rest independently. After the teacher was completely convinced of his powerlessness, he said to Hussein, "Read it yourself, solve the theorems, and then come and show me the results." After that, Hussein was engaged in studying what was written in books independently. He had to learn many of the problems that arose from his teacher's student. By the time Ibn Sina reached the age of 18, he had learned most of the sciences. Ibn Sina became interested in medicine at a very early age. At the age of 12, Ibn Sina began to study medicine on the advice of Abu Salah al-Masi, a famous doctor and philosopher of that time. In a very short time, Ibn Sina, who achieved success in the treatment of various diseases, also gave advice to the most famous doctors who came to him. At that time, Ibn Sina was 16 years old. His great interest in medicine led him to the famous medical scientist of Bukhara, Abu al-Mansur Qamari. Not satisfied with the knowledge he received, Ibn Sina engaged in independent medical activity. After a short time, Ibn Sina, who became very famous as a doctor, was invited to the palace to treat the emir of Bukhara, Ibn Mansur. The famous doctors who were involved in the treatment of the emir could not achieve any positive results. Ibn Sina was able to treat the emir as he wanted, and the benefit was that they allowed Ibn Sina to join the famous Bukhara library of that time. Ibn Sina considered the 10 years he spent working at the Bukhara library to be the most important stage of his life. It was then that he had a desire to realize the idea of creating a generalizing work on medicine during the period of his life at the Bukhara library. This work was to show the names of diseases, all their symptoms, their causes, and methods of treatment. For this purpose, Ibn Sina made the necessary extracts from various books and abstracts and regularly summarized them. This was the beginning of the creation of the work, The Canon of Medicine, which Ibn Sina had been working on for many years. That work is one of the most prominent books in the world of medicine. Essentially a complete medical encyclopedia, this book is a perfect collection of knowledge about human health and diseases. This work, consisting of 200 printed sheets, was translated from Arabic into Latin in the 12th century and spread throughout the world in manuscript form. After the invention of the printing press, the The Canon was one of the first printed books, and in terms of the number of editions it even competed with the Bible. The Latin text of the Canon was first published in 1473 and the Arabic text in 1543. This work, which was published at least 30 times, was used as a basis for teaching medicine in European universities for 5 centuries. Ibn Sina was the first to show the role of the nervous system in the pathogenesis of bronchial asthma. He wrote that this disease occurs as a result of damage to the nerves of the spinal cord and brain. Representatives of modern medical science have recently come to this conclusion. Ibn Sina was the first in the history of medical science to describe the picture of rabies, its treatment, and causes of the disease. The correctness of his approach to this issue was confirmed only in 1804. Ibn Sina wrote back in the 11th century, at a time when there were no microscopes and laboratories. If a patient bites someone in the heat of his illness, he can transmit his disease to them. People who eat and drink what was left in front of the patient can also contract rabies. Ibn Sina believed that the best medicine for the treatment of rabies was a solution made from the liver of a rabid dog. This was confirmed after many centuries. The method of vaccination appeared. Ibn Sina was the first in the history of medicine to determine that measles and smallpox were separate diseases. Ibn Sina was the first in the history of medicine to use mercury in the treatment of syphilis. For the first time in the history of medicine, he highlighted the importance of the problem of diabetes and sugar in the urine. The scientist wrote in his canon that the sediment in the urine of patients with diabetes is as sweet as honey. The correctness of this idea was first confirmed in Europe in the 18th century. Modern doctors could not add anything to the characteristics of the diabetes clinic given by Ibn Sina in the 11th century. Ibn Sina also indicated the causes of the disease. In his opinion, the cause of the disease is impaired liver function, mechanical and hepatic jaundice. Ibn Sina skillfully distinguished these jaundices from other jaundice diseases. Ibn Sina was the first to define myocardial infarction in the history of medicine. He wrote that when the arteries of the heart are blocked, the heart is prevented from functioning. Ibn Sina said that heart diseases are also related to diseases of other organs. Modern medical science was able to determine this only in the 20th century. Ibn Sina was the first to describe anthrax and distinguish it from other diseases. In Europe, this was confirmed only in the 18th century. Ibn Sina was the first to show that mosquitoes are the causative agents of cutaneous leishmaniasis. This idea was experimentally confirmed in Europe only in 1921. Ibn Sina was the first to use palpation and percussion of the liver when making a diagnosis. There are other innovations that Ibn Sina brought to medicine. Ibn Sina left behind a legacy of perfectly developed methods of eye surgery. The principles and goals of the surgical treatment of trichiasis, described by him, are almost the same as modern methods. His methods for setting fractures of the skull, jaw, collarbone, sternum, shoulder, ribs, spine, shoulder, forearm, wrist, finger, pelvis, hip, calf, and paw bones are still in use today and are often referred to as the Avicenna method. Some of Avicenna's observations on the medicines he obtained from plants are still valid in the medical world. Today, doctors, medical organizations, and biologists around the world continue to learn from Ibn Sina, especially the truth that plants are a source of healing, and they see him as the greatest physician in the history of medicine. It should also be noted that Ibn Sina is considered the founder of the science of psychology with his works Kitabu an-Nafs. Ibn Sina was influential in the fields of medicine, mathematics, logic, philosophy, astronomy, physics, chemistry, pharmacology, literature, and archaeology. He is best known for his work in medicine. As a medical specialist, he revolutionized many of the methods used in medical science and made many discoveries. Ibn Sina discovered that blood is a nutrient-carrying fluid, that lung movements are passively related to chest movements, that sugar is present in the urine in diabetes, and that scarlet fever is a disease. Ibn Sina was also the first to use anesthetics in medical operations. He was also the first to suggest that diseases are caused by microbes. Ibn Sina, 900 years before our time, spoke about the existence of microbes, saying, "Every disease is caused by a worm." Unfortunately, we do not have an instrument to see them. He also invented palpation, a method of detecting internal diseases by examining the body with the fingers. The process of purifying water from microbes using a filter for the first time is also one of Ibn Sina's inventions. Ibn Sina was the first to reject the claim that soft tissues like the brain and hard tissues like bones do not become inflamed, and he dismissed this idea by saying, "Bones also become inflamed." He was also the first to distinguish infectious encephalitis from other infections. At the same time, Ibn Sina explained the ulcer, which he called Iranian fever, in a clear and comprehensive manner. It was Ibn Sina who first suggested that diseases could be inherited genetically and that this could manifest itself in the form and function of the organ. Ibn Sina stated that black lung diseases could cause digestive disorders, bleeding, and disrupt the physiology of the spleen and diaphragm. He explained that jaundice comes from the disruption of the liver tissue or from the blockage of the bile ducts. While the mentally ill were beaten in dark holes and caves and tied with heavy chains, Ibn Sina came up with the idea that it would be more beneficial to treat them like a human being. Ibn Sina was the first to say that the cause of diseases is invisible microbes. Ibn Sina was the first to anesthetize the patient during operations, thus reducing their pain. Ibn Sina was the first to say that the cause of diseases is invisible microbes. Ibn Sina was the first to anesthetize the patient during operations, thus reducing pain. Ibn Sina analyzed the causes of diseases such as plague, cholera, jaundice, and showed methods of treating meningitis, stomach ulcers, and a number of other diseases. He also described the structure of the eye muscles for the first time. Until then, it was believed in world medical science that the eye radiates light like a flashlight and that a person sees when these rays hit an object and bounce off it. While studying Arabic literature, Ibn Sina became deeply acquainted with the works of the classics of Arabic poetry. This greatly helped Ibn Sina to develop as a poet. In the early days, he wrote short poems. Later, he began to write odes and poems. According to Abu Rayhan Biruni, scientific works were written in poetic form from ancient times. Even grammar books were written in poetry among the Arabs. These books, which were passed down from generation to generation, were considered very popular. Ibn Sina also used the form of poetry to widely spread scientific knowledge among the people. Ibn Sina's life, mood, and suffering, his protest against ignorance and injustice found their bright reflection in his poetic works. Ibn Sina was also very interested in logic. He wrote books and poems on this subject. In the poem consisting of 297 verses, he defined science and many terms, categories, syllogism, analogies, dialectics, rhetoric, sophistry, etc. Ibn Sina wanted the science of medicine to gain wide popularity among the people. His poem about medicine, Al-Arjuza fit Tib, takes second place after Canon in terms of the breadth of its material and deep content. This poem, consisting of 2,652 verses, was translated into Latin in the 12th century and later into other European languages and was published. Other poems of Ibn Sina are devoted to the characteristics of the 4 seasons of the year, hygiene issues, anatomy, etc. Ibn Sina also has prose literary and philosophical works. Examples of these are Treatise on the Bird, Narrative on Joseph, etc. His work on the art of poetry is devoted to literary criticism. Ibn Sina pays special attention to the issues of protecting human health in his poems. He wrote about hygiene, nutrition, and caring for the sick. Ibn Sina especially shows that the prevention of diseases is more important than their treatment. Ibn Sina is a scientist who has deeply penetrated all areas of medical science and made scientific innovations. Ibn Sina knew well that every born person would die one day. In one of his Rabies, he wrote that, although I managed to unravel the secrets of the world from the earth to the celestial bodies, I could not untie the knot of death. This great personality, who was able to cure incurable diseases, devoted his life to the cause of science and the enlightenment of the people. He faced hardships arising from injustices and did not hesitate to speak his mind before the emirs. All this resulted in the early death of Ibn Sina, who was without a family and without children. Ibn Sina died in 1037 at the age of 57. Sina was buried in the Ala al-Dal mausoleum in Isfahan. In Europe, Ibn Sina is known as Avicenna. He is one of the first to be mentioned among the 100 scientists who changed the world. The books written by this great personality in the field of medicine were used as basic resources in the world of medicine for nearly 600 years. The book The Law of Medicine was accepted as a basic resource at the universities of Montpellier and Louvain in France until the 17th century. Until 600 years ago, this book was the first of the 9 basic books in the library of the Faculty of Medicine in Paris. Aphorisms of Ibn Sina. Asterisk, the soul of the universe is truth. Asterisk, if my friend is friends with my enemies, it is impossible to continue the friendship with him. Protect yourself from sugar mixed with poison. Protect yourself from a fly sitting on a dead snake. Asterisk, whoever does not appreciate happiness when it is his, he approaches unhappiness. Asterisk, time does not pass, it is we who pass it. Asterisk, unemployment and idleness not only create ignorance, they are also a source of disease.